Hey there, it's Dr. Jyme. Welcome to EquiSUMMIT. If your brain isn't already overflowing with information around equine nutrition, I am sure that it will be by the end of this event. A special focus for this year's EquiSUMMIT is ulcers. Many horse owners worry about ulcers, and in all honesty, even equine nutrition experts may struggle a little bit. There is so much to understand around this topic, and we're here to cut through the mud and empower you with the foundational knowledge necessary for understanding what it means for a horse to have ulcers. So be sure to catch the session titled Inside Out Tackling Equine Ulcers. There are even some tips at the end around functional nutrition and things that you can use to help support your horse's gastric health. I'd also like to invite you into Bluebonnet's virtual booth, where you will find resources on some of my favorite feeds and supplements. If you haven't noticed, Bluebonnet Feeds and Stride Animal Health have joined together under one simple name, Bluebonnet. Rest assured, we're still the same team with the same formulas. We just operate under one name and one logo. If you are interested in a free nutrition consultation with the Bluebonnet team, simply scan the QR code in the corner of this screen. And as always, if you are into podcasts, don't forget to check out my podcast, Feed Room Chemist, for science-filled, easy listening episodes about all things equine nutrition. I'll see you in the sessions.
I
Okay.
appreciate everyone for joining this session. My name is Dr. Jyme Nichols. I am an equine nutritionist at Bluebonnet, and I am the creator and host of the Feed Room Chemist podcast. I just want to, before we get started, I want to thank Bluebonnet for being a major sponsor of EquiSUMMIT and for always being so supportive of my efforts to offer free and accessible education to horse owners all over the country and really all over the world. So, this session is all about ulcers, and I'm sure that many of you are familiar with the term ulcer, but just to make sure that we are all up to speed here. So, an ulcer is an open sore in bodily tissues that fails to heal. More specifically, in what we're talking about today, a stomach ulcer is a break in the stomach lining that fails to heal. So, when we consider the prevalence of ulcers in horses, researchers estimate that around 60% of performance horses experience ulcers and over 90% of race horses. Okay. So, the odds of a horse developing ulcers increases with certain stress things like training, travel, stalling, you know, all the things that we just do with our horses on the daily, right? Now, before we get too far into this, I think it's really important to understand kind of the lay of the land in terms of the horse's gastrointestinal tract. So, the horse is what we call a monogastric animal, meaning they have one single chambered stomach. So, the food enters the stomach from the esophagus and then it exits the stomach and heads into the small intestine. So, it should be no surprise to most of this audience that the horse's body functions best when they are allowed to eat all day long, right? Their single stomach is very small relative to the size of their body, which is why they do better if they can take in these small amounts of food all day long versus gorging on one or two really large meals. Now, food moves very quickly through the stomach of the horse, and the stomach accounts for a very small portion of the total digestive tract, which is very different from other grazing animals like ruminant animals like cattle, sheep, and goats. So, when I say that a horse's stomach is small compared to these other grazing animals, I thought it might be helpful if I give you a little bit of perspective. So let's take a cow, for instance. The stomach of a cow has four chambers and it accounts for nearly three-quarters of their total digestive tract. Okay, so in this graph, the offset bright pink portion shows just how much of the digestive tract the stomach takes up in that of a cow. In fact, a cow's stomach is about the size of a 55-gallon trash can. That is huge, especially when you think about their overall body size. I mean, they're big, but they're not that big, right? Well, on the flip side, a horse's stomach is way smaller. it accounts for only about 10% of the total digestive tract. So the small little bright pink pie slice at the top shows us how large, or should I say how small, the horse's stomach is relative to the rest of the digestive tract. It's only about 3 to 5 gallons in size. I mean, that's barely enough to fill a flatback water bucket. So there's a very big difference in the size of a horse's stomach and the stomach of a cow. Now, here are the two graphs side by side. I color coded them to help show the difference in the foregut and the hindgut. So the pink colors are the stomach and the small intestine. So that you can see that in a cow, the pink portion or the foregut essentially is the bulk of the digestive tract. However, in the horse, the vast majority of their digestive tract consists of these green segments. And it's those green segments that are reflecting the hindgut portion of the gut. And that's what's responsible for forage and fiber digestion and fermentation in the horse. There is also a big difference between a horse and a cow in terms of where that fermentation happens. So in the cow, it happens at the beginning of the digestive tract in this chamber of the stomach called the rumen. Now, in the horse, fermentation happens primarily in the cecum, which is down the line from the stomach and the small intestine. So the main point here is that a horse and a cow have radically different digestive systems. So in the nutrition world, we often say that the horse is backwards to the cow or the cow is backwards to the horse. And this is why in many cases, it just does not work well to feed a horse like a cow. Now, the title of this presentation was Inside Out, right? So we're going to take a look at what the horse's digestive tract looks like in real life. If you happen to be the type of person that gets a little bit queasy, you might try to glance away during this slide and possibly the next. Thanks to the University of Tennessee Veterinary Medicine, we have a really great image of the horse's GI tract laid out so that you can even further appreciate how small the stomach is compared to the other segments of the digestive system. So the flow of food in this particular scenario would be from left to right. The food moves from the mouth and the esophagus into the stomach. Okay, then it moves to the small intestine, then to the cecum, large colon, small colon, rectum. Those are all collectively referred to as the large intestine in this particular picture. Now, we often talk about the horse's digestive tract in two kind of distinct segments, the foregut and the hindgut. So here I have drawn a line to illustrate that the left half, consisting of the stomach and the small intestine, is what we consider the foregut, and then the right half is what we consider the hindgut. I think it's important for people to understand these differences because how we support a horse nutritionally changes based on what portion of the digestive tract we're trying to target. Now, to isolate the GI tract down even a little bit further, this is an image of just the stomach. The reason I'm drilling down to just the stomach is because this is where gastric ulcers occur. Okay, this is the only location that we can definitively diagnose ulcers because this is the only portion of the GI tract that we can actually see with a scope. Okay. This is important to understand because you might hear people talking about ulcers in other parts of the GI tract, like the small intestine or the colon. Now, ulcers most certainly can exist at any point along the GI tract. We just can't see them, which means we can't definitively diagnose ulcers in any location other than the stomach. That's where the lingo gets a little tricky when it comes to talking about ulcers. But the technology is rapidly advancing, so I'm sure it won't be too terribly long until we can get a visual on other parts of the horse's GI tract with just like some external camera mapping. I mean, the technology's got to be there, or it's going to be there at some point. We're just not there yet. So now I'm going to open up the stomach so that you can see what it looks like on the inside. Okay, so the stomach is divided into two key areas. The upper region, which is covered by squamous tissue, and then the lower region, which is covered by glandular tissue. So these two regions are separated by a very distinct line that I hope you can appreciate in this slide. That line is called the margo plicatus. So I wanted to call out these two regions of the stomach because when we are talking about gastric ulcers, it is very important to understand specifically where the ulcers are occurring because the location of the ulcer is going to influence the treatment protocol. So, like I said earlier, the only way to definitively diagnose gastric ulcers is by having your horse scoped. This is performed by your veterinarian after your horse has been restricted of food for a certain period of time. Okay, so you have to fast them. The horse is then sedated, and then a very long fiber optic camera is run up one nostril, and then the horse essentially swallows the camera, which allows it to gain access down the esophagus. And then the veterinarian can move it on into the stomach and start the exploring. So once the end of the cable is in the stomach, the camera then transmits an image back to your veterinarian so they can see what's going on in those different areas of the stomach. Now, I'm sure that many of you are wondering what that image looks like that the camera transmits back. So these are examples of two different horses. The image on the left shows a healthy, normal stomach lining. The image on the right shows a different horse that has some pretty substantial gastric ulceration. Okay, your vet doesn't get a huge image of the whole stomach all at once, right? This is not the cinema. Okay, they have to try to maneuver this tiny little camera around to all of the different areas of the stomach in order to view one tiny segment after the other. And keep in mind, they have to do all of that while trying to get a sedated horse to cooperate with them as this massive cable has been run up their nose, down their esophagus, and into their stomach, right? Like, this is not necessarily an easy task. Like, there is definitely an art to doing this. And so as horse owners, we have to keep in mind that sometimes it is not always possible to get a really, really good view of every portion of the stomach, or particularly of the furthest regions of the stomach, such as the pyloric region, or if we're really lucky, like we try to get in, the veterinarian will try to get into the first part of the small intestine, but that is not always possible. Okay, let's talk terminology for a minute. So the term equine gastric ulcer syndrome, EGUS, was first used in 1999 to describe gastric ulceration in the horse. But it's important to note that this is just an umbrella term, okay? So when we talk about stomach ulcers, we should really be a little more specific about distinguishing what region specifically we're dealing with, okay? This is why you might see both ESGD and EGGD being used to describe gastric ulcers. So ESGD stands for equine squamous gastric disease, and that refers to ulcers in the upper portion of the stomach, known as the squamous region. EGGD stands for equine glandular gastric disease, and that refers to ulcers in the lower portion or the glandular region. So again, it's important to differentiate between these two because the treatment protocol, even the pathophysiology, all of this can be a little bit different for each one. So when it comes to grading systems, for squamous ulcers, which again is the upper region of the stomach, there is a very well adapted grading system. It rates the severity of squamous ulcers on a scale of 0 to 4, with 0 having normal, intact, healthy lining. And then grade 4 would be like extensive lesions, deep erosion of that stomach lining. So just to help orient you to these images, the white section that you see, or the lighter colored section that you see, is the squamous mucosa. Okay, this is the upper portion of the stomach. It is very susceptible to damage from gastric juices. Okay, the squamous region does not have the ability to absorb nutrients or excrete acid, so it really just acts as like this protective barrier. On the other hand, the lower pink portion of each picture, that's the glandular mucosa. Okay, so that's the lower portion of the stomach, and that is the tissue that is made up of those mucus producing cells and gastric glands, and that's what's responsible for secreting the hydrochloric acid. So just to kind of help you know the difference in what the upper and lower region of the stomach is doing. So when it comes to that lower region, the glandular region, there is no universal scoring system. Okay, so there's no universal scoring system for glandular ulcers. If glandular ulcers are identified, they are just described according to like their location and their appearance. Meaning they might be listed or described or written on the patient paperwork as having nodular, flat, raised, depressed characteristics. The location is typically identified, right? Do they appear in the cardia, the fundus, the antrum, the pylorus? And then your veterinarian may also describe the severity and again, that characterization, right? So like, are they red? Are they bleeding? Are they filled with pus, right? Um, these things, these glandular ulcers, they really can show up in a lot of different ways, which I hope that you can appreciate from these small samples of pictures that I've shown here. They can really vary, which again is part of what makes it so hard to create this universal scoring system. Okay, let's shift gears and highlight some of the risk factors for a horse that might cause them to develop ulcers. So I like to think of the risk factors in two separate categories, the environment and the diet. Now, it's really easy to forget that we ask horses to do things that they are simply not designed to do, right? A horse is physiologically designed to have their head down, grazing and walking with a herd of companions for most of the day. Almost everything that we do with them in the modern world is counter to that. Okay. We put them in solid stalls or we put them in small pens, dry lots, places that limit their movement, right? We often isolate them. One horse per pen or per stall. We want to be able to feed them very specifically, right? And so we isolate them. It's like one horse per area. So we take away their ability to be part of a herd and all of the dynamics that accompany being part of a herd. We put them in tin boxes on wheels, and we travel all over the state and the country with them bumping along in tow behind us. We choose their trainer, right? Whether it be ourselves working with them or someone that we choose. You know, I find it fascinating. Researchers have found significant correlations between trainers and ulcer prevalence, meaning horses are more likely to have ulcers if they're in training with some trainers compared to other trainers. Okay. Obviously, there's a lot of factors that go into a trainer's program. So, as a horse owner, I think it's worth kind of keeping in the back of our mind when we're choosing a trainer, like how do their client horses look? What has been the experience of other people who have sent horses to that trainer? How closely does the trainer's environment match the horse's environment at your own home? For example, if your horse is used to being turned out in a large grass pasture, but you take them to a trainer and the trainer that you're going to have them with keeps them in a box stall 24/7, okay, that's a pretty significant change for that horse. And that is going to dramatically increase the risk of that horse developing ulcers. Oh, and here's another interesting one, right? We make our horses listen to the radio. Okay, this one was really surprising to me, but researchers found that horses are approximately 3 times more likely to develop ulcers if a radio plays in the barn for 4 hours or more each day. I mean, how many of us are guilty of leaving the radio on all day long in the barn, right? And interestingly, talk radio was just a little bit worse than music radio whenever they looked at these results. And so all of this got me thinking like, how about all those horse shows and events where the horses are stalled for days or even weeks at a time, and the announcer is talking and playing over the PA system constantly all day long in those stall barns? And then when the announcer's not talking, they have music blaring, right? So, I mean, no wonder some horses absolutely fall apart when they go on the road to these long shows. Okay, let's take a look at some feeding and diet related risk factors, right? So we've covered a few of the environmental factors. Let's look now at diet. Um, let's be honest, not all horses have the luxury of grazing pasture all day long, okay? Whether it be for management reasons or health conditions. There are a lot of reasons why horses have to live in box stalls or small pens or dry lots. Um, a lot of horses are fed a large meal of hay and grain once or twice a day, right? Researchers have found that going 6 hours or more between forage meals increases the risk of developing ulcers. Okay. Now, that doesn't mean just hay. When I say forage, that can be pasture too, right? Because a lot of times horses will be on kind of this rotation where they go out on pasture for, part of the day and then they get brought into a dry lot for part of the day. And so again, the researchers are saying that if you are going 6 hours or more between these forage meals, whether it's hay or pasture, this is going to increase the risk of that horse developing ulcers. And and then like how many horses do we know that are fed at 6 or 8 in the morning and they're done eating all of their hay and food by 10 a.m., right? And then they don't get fed again until 6 or 8 that evening. I mean, that means that they are spending well over 6 hours each day without anything to eat. So again, back to how you manage your horses. If there are ways to slow down their eating time, like using slow feeder nets, hay nets, or grazing muzzles, okay, those could all be really helpful for ulcer prevention and extending the amount of time that they spend eating in a 24-hour period or a 12-hour period. Or if you happen to have a horse that's a little bit of a harder keeper, you can keep hay in front of them all the time, right? Offer more hay so that they always have it in front of them. Or if you happen to be in a position where you could offer a noontime feeding, that could also be very helpful. Water is another thing to keep in mind, right? It is an excellent natural buffer. So horses that drink well and have access to water all of the time just naturally are less likely to develop ulcers. Okay. Now, on the flip side, horses that don't drink well or horses that are purposely restricted from water for part of the day, they are actually 2.5 times more likely to develop gastric ulcers. So I always cringe when I hear, people make comments like, well, they get access to water at night, but in the daytime, they don't. I'm like, no, don't do that. Horses need access to water all of the time. And it doesn't change with season, right? I think sometimes people think of water access only during the summer because it's hot. But water access in the winter time might be even more critical because in the wintertime and the cold months, horses are consuming more hay, which is higher in dry matter, so that they can stay warm. And so this is when it is most common for horses to have an impaction colic is during the winter because the water is typically cold, and so they're less likely to drink as much water, or their water freezes and they can't actually drink the water. And then they're trying to eat as much hay as they can in order to keep their body warm. And so this just absolutely sets up a disaster, not only for impaction colic, but also for gastric ulcers. So I encourage you, summer or winter, keep open, cool, clean, fresh water available to your horses all the time. All right, high starch meals are also problematic. I cringe when I hear the recommendation from well meaning professionals to put a horse on oats when they have ulcers, right? This is exactly the wrong move because oats are very high in starch. And starch is directly associated with an increased likelihood of ulcers. In fact, if you fed 1,000 grams of starch per day to an 1,100-pound horse, this doubles their chance of developing ulcers. So to put that in perspective, your horse is twice as likely to develop grade 2 or above ulcers if you are feeding 2 pounds of oats morning and night, right? So if you, let's say you happen to be using a square plastic 3-quart horse feed scoop, okay? That can hold anywhere from 2 to 3 pounds of oats, depending on the brand of your scoop. I encourage you to go weigh your scoop because it also is going to depend on the bushel weight of your oats, whether they're rolled or whole. But these numbers are very conservative, right? A typical horse scoop completely full is generally going to hold at least 2 pounds of oats. And so if you are feeding that scoop in the morning and scoop at night of oats, you are more than likely going to be above that 2 grams per kilogram body weight of starch per day that the researchers have linked back to that higher likelihood of developing ulcers. Now, many horses are also on medications, particularly NSAIDs or non-steroidal anti-inflammatories. So think of phenylbutazone or bute or banamine, right? These NSAIDs are known to damage the gastric mucosal lining, right? So a horse that is under frequent use of these NSAIDs, like if they get used every weekend for shows, or if they're under extended use of these medications, like daily use for periods of time to treat certain situations, again, your horse is going to have different things going on. But if these horses are on bute or banamine frequently or for extended periods of time, they are going to be more likely to develop ulcers, particularly in the glandular or the lower portion of the stomach. All right, let's get into the signs and symptoms of a horse with ulcers. So to catch the early signs of ulcers, you have to know your horse, right? You have to know what is normal so that you can recognize when something is abnormal, right? So behavioral changes are typically first to appear, and they might start really, really small, okay? So you might notice changes just in your horse's facial expressions when you saddle. Um, this picture is obviously this guy's being pretty dramatic, right? But pay attention to their ears, their eyes, their mouth. Some horses are really expressive and they'll give you those subtle little signs when you saddle, right? They might just barely twitch an ear, or they might just barely squint their eye, or they might just slightly roll their lip up, right? There's some really small, subtle signs that they'll give you in the beginning if you pay attention to it. Now, some horses will be a little more aggressive, right? Like the guy in this picture. So maybe they'll reach back and actually try to bite you when you pull the girth, or maybe they try to bite at the tie rail or the cross ties, right? So some horses might just swish their tail a little bit. Now, I've given all of these examples as you're saddling, but this can also happen with you on their back as well, right? So if you, let's say you ask for a small cue and they are normally very compliant, but suddenly they start to refuse. Or maybe you notice those little tail swishes or those little ear pinnings, right? These are all signs of discomfort. Now, it's possible they could have a lameness or something else going on, and that could be what's irritating them, but it could also be ulcers or some kind of digestive discomfort as well. After some time, horses that are dealing with ulcers, it'll become much more apparent, right? They may start to lose their top line. They may start to drop body condition, their body weight may fall off. They may have a really dull hair coat. They may even start to exhibit some signs of colic. Okay. So it's in this phase where I see a lot of people start trying to feed extra grain or they start introducing new supplements to try to get their horses looking better. And it's very common for a horse in this phase to be really picky about what they eat. Okay. So some early signs, a horse, if you notice that a horse is starting to eat their grain at a much slower pace, or if they start to refuse their grain altogether and choose to go to hay instead of their grain, these can be little signs that this horse is dealing with some ulcers. Okay. This is where it also gets really frustrating to the horse owner because as an owner, we know that the horse needs to eat more, right? Because they clearly don't look that great, but the horse does not feel like eating, right? They have a painful, upset stomach and it can make them depressed. It can make them lethargic acting. I mean, you might feel like you're like losing your horse. It can also have the opposite effect, though. Some horses might become very aggressive. Some horses might get really nervous. I've seen like some horses will take on self-mutilation tactics, right? So every horse is going to be a little bit different. Diarrhea is another one that we're not entirely sure why or how diarrhea is connected with this, but it's not uncommon for horses who all of a sudden start to deal with diarrhea and loose stool. It's not uncommon for them to be dealing with some gastric ulcers. All right, let's say that you have a horse with some or all of these symptoms. What do you do now? Well, now is the time to call your veterinarian. Okay, so the outward signs or symptoms of ulcers can actually share similar signs and symptoms with other diseases and conditions. So it's really important to work with your veterinarian and rule out those other possibilities. But let's say you're at the vet, you know, done the workup and your veterinarian is suspecting ulcers. Okay. At that point, each veterinarian is going to take a slightly different approach to how they handle how they're going to handle a horse with suspected ulcers, right? So most are going to want to go ahead and scope. And the reason for that is so that they can see exactly what they're dealing with and get a baseline, right? How severe are the ulcers? Are they even present, right? Or are we chasing the wrong rabbit? Are those ulcers present in the squamous tissue, the upper portion, or are they present in the glandular tissue, the bottom portion, right? There's lots of things that will change how they handle the treatment plan for that horse. Now, sometimes scoping is not in the picture. So if that's the case, your veterinarian may make kind of a presumptive diagnosis of ulcers, and they may opt to just go ahead and start administering medications and see if the symptoms then resolve. Now, it is important to understand there is no relationship between ulcers in the squamous region and ulcers in the glandular region. Okay, so just because a horse has ulcers in the upper portion of the stomach does not mean that they also have ulcers in the lower portion, and vice versa. If a horse scopes clean in the squamous region, right, that doesn't mean they're clean in the lower region. They could be covered up with ulcers in the glandular region or even in the first part of the small intestine, right? There is also, interestingly, not a strong correlation in the outward signs and the severity of the actual ulcers. Okay, so what I'm saying there is some horses are just a little more stoic than other horses, right? So some may have very severe ulcers, but really mild outward signs. And then other horses might have just like this incredibly strong, dramatic outward symptoms, but then you go and scope them and their ulcer grades are actually really low. So there is no direct correlation as to what you're seeing from the outside and what they're experiencing on the inside. All right, so let's talk for a second kind of about the specific medications that might be used. So the specific medications, this needs to be discussed with your veterinarian. It really is beyond the scope of this presentation to explain each of the options. But just know that kind of the most common first approach is to reduce the acid production through the use of through the use of a proton pump inhibitor, or through like H2 antagonists or H2 blockers. Omeprazole and ranitidine are the most commonly prescribed drugs to accomplish this. And then if a glandular ulcers are present, it's logical then to prescribe a mucosal protectant such as sucralfate. Studies show up to 67% healing rates of glandular ulcers in the pyloric region when omeprazole is used in combo with sucralfate. So there's going to be a lot of, like I mentioned earlier, it's important to understand where the ulcers are so that your veterinarian can appropriately prescribe a treatment protocol, right? So if you don't allow your horse to be scoped, the veterinarian unfortunately kind of has to shoot in the dark for a little bit and maybe try a combination of some of these meds until they get to the right thing. The other thing on that note is just because one combination worked for your friend and her horse or his horse doesn't mean that that same combination is going to work for your horse. And again, the reason for that is because not all ulcers are equal, right? It all depends on where those ulcers are located and what exactly you're dealing with from an environmental standpoint, dietary standpoint, and the protocols that are recommended by your veterinarian. Okay, so in addition to any prescriptions that your veterinarian might make, it's important to consider what might have led to the development of ulcers in the first place. And you should do your very best to try to make improvements to the diet, to the environment, or to both, right? So try to keep stress, training, and travel to a minimum while you are trying to allow these ulcers time to heal. As I described earlier in the presentation, horses do best when we can align their daily lives with the way that they are physiologically designed. So do your best to let your horse be a horse, right? At minimum, allow horses access to water and forage at all times. If a horse is not able to have full access to forage, of course, try to use slow feeder hay nets Um, you can use a grazing muzzle to help extend their eating time without adding, just excessive amounts of forage. So small, frequent meals are always going to be preferred to one large meal, and forage and fiber should always be the foundation of the diet. Now, if grain is used, be mindful of your starch and your sugar levels, okay? That it is my personal opinion to avoid corn and oats, or at the very least, offer them in extreme moderation if you are going to use them. It is important to work with an equine nutritionist to tailor the diet to the needs of your individual horse, right? Your horse's size, activity level, attitude, age, all kinds of physiological aspects are going to impact what and how much you should feed your horse, okay? So keep in mind that providing calories from fat and fiber sources may be a little bit better suited to horses that are prone to ulcers. So using fat and fiber as your calorie source versus using starch and sugar as your calorie source. That's going to be a little bit better approach for helping prevent ulcers. I am also a fan of functional nutrition for ulcer prevention. So I like to use acid buffers such as lithothamnium, right? It helps curb the acid in the stomach, but it doesn't affect the acid production. Okay, so you're not going to get rebound effects by using something like lithothamnium. I'm a big fan of plasma. The reason there, it's been proven through research to actually help reduce the chance of ulcers in young horses that are going into training. Okay, plasma is really good at helping support epithelial lining. Also very good at helping keep inflammation within the body down and moderated. Um, I like to use natural mucosal supporting agents like slippery elm. And I am also a really big fan of components that are known to support that epithelial lining and that tight junction health. So things like butyric acid and zinc. Okay, as we wrap this up, the real take home here is that if you have never had a horse with ulcers, you either haven't owned horses very long, you haven't ever gotten a horse scoped, or you're about to have a horse with ulcers, right? We are all impacted by this condition, regardless of whether we know it or not, right? We are all going to experience a horse with ulcers at some point, right? No matter how well we take care of our horses. And the reason is just there are things that we can't control that impact the stress level of our horses, right? And in 60 to 90% of horses, that stress shows its face as ulcers, right? So as owners, we've got to do our best to be aware of the horses that are most at risk, and we need to do everything we can to minimize their chances, okay? So we must pay attention to those early signs. We've got to take these preventive measures. Remember, an ounce of prevention is worth a pound of cure. I 100% believe in that old saying. And then lastly, be sure to work with both a veterinarian and an equine nutritionist. Okay, the two professions are not exclusive, right? Neither one provides a one-stop shop for ulcer care and prevention, right? Your veterinarian and your nutritionist are complementary to one another, and the horses that do the best are usually the horses that have owners who are willing to work with both their veterinarian and their nutritionist to maximize the program. All right, that's a wrap. I want to thank Bluebonnet one more time for sponsoring this presentation, and I want to drop a shameless plug again for Feed Room Chemist podcast. If anyone is interested in equine nutrition, this is a podcast, again, created by yours truly, and I just want to invite everyone to go check it out on their favorite podcasting app. So I'd be more than happy to take questions at this point.